All right, everyone, get ready for a deep dive today. We're tackling a topic that's, well, pretty significant: obesity.
It really is, and it's a topic that unfortunately gets oversimplified a lot.
Yeah, it's definitely more than just a number on the scale. We're not just talking about fitting into certain clothes.
Exactly. It's about understanding a health issue that affects so many people, and it's a really complex issue.
For sure. It has so many different facets, it seems like.
It really does. It's rooted in our biology, our environment, even our psychology.
Okay, so to start unpacking this, I think a lot of people are familiar with the term BMI, body mass index. Is that a good place to begin?
It's definitely a common starting point.
Yeah, I've always heard about that. You take your height and your weight, you plug them into a formula.
Right, and that gives you your BMI number.
And generally, I think most people know that a BMI over 30 is considered obese. But is there more to it than that?
Well, that's the thing. BMI doesn't give you the complete picture.
So it's not the be-all and end-all.
Not really, no, because it doesn't differentiate between fat and muscle.
Ah, okay.
So you could have someone who's very fit, like a weightlifter with lots of muscle, and they might still have a high BMI.
That makes sense. So it's just one piece of the whole puzzle.
Exactly. It's one clue, but we need to look at other things too, like lifestyle, overall health, and each person's individual situation.
Okay, so BMI is helpful, but it's not the whole story. Now let's get into what really causes obesity. It can't just be as simple as eat less, move more, right?
Definitely not. There's a lot more to it than that. It's way more complex.
What are some of the factors then that contribute to obesity?
Well, a major factor is the kind of food environment we live in today. I mean, we're surrounded by these highly processed foods.
Oh, yeah.
And they're made to be super appealing, you know?
That's true. Like they're engineered to be tasty.
Exactly. And that makes it tough, almost like they hijack our brain's reward system.
That's fascinating. I've read a bit about that. They trigger those dopamine releases in the brain, which make us crave them. Even when we aren't actually hungry. It's like we're fighting our own biology.
It really is.
Wow. So it's not just a matter of willpower then. It's like our brains are wired to want these foods.
Yeah, you could say that.
That's no wonder so many people have trouble with it. But it's not just the food itself, right? I mean, our lifestyles have changed so much too over the years.
Oh, absolutely. Our lifestyles play a huge role. We've become so much more sedentary.
Much less active.
Exactly. Many people spend hours sitting, whether at a desk, in the car, or just looking at screens.
It's true.
And that lack of activity throws off our energy balance. It makes it so much easier to gain weight.
So we've got the food environment and our more sedentary lifestyles. What else?
Well, there's also the genetic component to consider.
Right, some people might just be more prone to gaining weight, right?
Exactly. Genes play a role in how our bodies store fat, how our metabolism works, even how our appetite hormones function.
So it could be kind of predetermined to a degree. Interesting.
It is. And speaking of hormones...
Yes, hormones. That's another thing I've read about. Like having imbalances can really make it hard to manage your weight.
It definitely can. Things like PCOS and hypothyroidism, for example, can really affect things.
I've heard of those, but how do hormones actually impact weight?
Well, you see, hormones like leptin and ghrelin, they act like messengers in your body. They tell your brain when you're full or hungry.
Oh, interesting.
But when those hormones aren't balanced, those signals can get messed up.
Ah, so they don't communicate properly.
Exactly. You might feel hungry even if you don't actually need more calories, like your body's working against you.
Wow, it's pretty wild how all these things are connected.
It really is. And we haven't even touched on things like stress and lack of sleep.
Oh yeah, those are big ones too. I know from experience those can lead to serious cravings.
They really can. Stress, for example, triggers the release of cortisol, and that can increase your appetite and lead to storing more fat, particularly around the belly.
Makes sense. And what about lack of sleep?
Well, when you don't sleep enough, your hormones get all out of whack. It can lead to feeling hungrier and craving those high-calorie comfort foods.
So it all ties back to hormones again.
In a lot of ways, yes.
Amazing. It's like our environment, our biology, our psychology, they all contribute to the whole complex picture of obesity.
It's a fascinating and complicated interplay of factors, for sure. And you know, this is why it's so crucial to understand all these different factors.
Yeah, totally.
It helps us to move away from just blaming people.
Right, instead of just saying, oh, it's their fault.
Exactly. And it helps us be more compassionate. Because obesity is not simple.
It's about understanding the complexity, like we've been talking about. And then from there, hopefully, we can start finding solutions. Speaking of which, where do we even begin with tackling something so multifaceted? It seems overwhelming.
Well, the first thing is probably shifting our mindset.
What do you mean by that?
It's about realizing there's no quick fix, no magic pill or anything.
Yeah, that makes sense.
Weight management that actually works, that's sustainable, it's really a journey. It takes time.
Okay, so patience is key.
And consistency. And you have to be willing to change your habits, but gradually, like making changes you can stick with over the long term.
Okay, so it's about those long-term sustainable changes. That makes a lot of sense. What are some practical steps people can take then? Like, where do they even start?
Well, let's begin with the foundation, which is diet. We need to move away from all those highly processed foods.
The ones that are packed with calories that just keep us wanting more.
Exactly those. And we need to focus more on giving our bodies what they really need.
Like real whole foods, things that are nutrient rich.
Exactly. Focus on foods that are actually nourishing. So instead of sugary drinks and fast food.
We choose things like fruits, vegetables, lean protein.
And whole grains.
Right, all the good stuff.
All those whole foods, they give us the vitamins and minerals we need, and the fiber. And they keep us feeling fuller for longer, which can help with those cravings.
That's so important. But I think it's worth saying that, making these changes isn't always easy.
Oh, I absolutely agree. It's tough, especially because there's so many tempting options around us all the time.
Everywhere you look, there's something delicious. And sometimes it feels like willpower just isn't enough.
No, sometimes it's not. That's where something called mindful eating can really help.
Mindful eating. Tell me more about that.
It's about really paying attention to your food when you're eating it.
Slowing down, savoring each bite.
Yes, exactly. Tuning into your body and what it's telling you. Like, are you actually hungry or are you full?
Being present with your food instead of just mindlessly eating it.
Right. And along with mindful eating, we need to start incorporating more movement into our lives.
Oh yeah, we were talking earlier about how we're all so much more sedentary now.
Exactly. So we need to figure out how to get ourselves moving more.
But what if you don't like, hardcore workouts or anything?
It doesn't have to be anything crazy. Start small, take the stairs instead of the elevator, walk or bikes to places when you can instead of driving. Even just getting up every hour if you have a desk job and moving around a bit.
Yeah, just little things throughout the day. I like that.
It all ends up, and as we're working on these changes to our diet and how much we're moving, we can't forget about the mental and emotional side of things too.
Right, because that plays a huge role in all of this. We were talking about stress and sleep earlier.
Exactly. Those are big ones. We talked about how stress can really mess with your hormones. It can make you hungrier and make your body store more fat.
So finding ways to manage stress is key, whether that's exercise, meditation, spending time in nature, whatever works for you.
Exactly. And getting enough sleep, of course.
Which could be a challenge sometimes, but yeah, it makes a big difference.
It really does. Having a consistent sleep schedule, making your bedroom dark and cool, avoiding screens before bed, all those things can improve the quality of your sleep.
Those are all good tips.
And, sometimes even when you're doing all those things, it's still not enough.
Right. Sometimes lifestyle changes alone might not be enough.
Exactly. And that's when medical intervention might be something to consider.
Okay, so things like medication or surgery, when would those options come into play?
Well, some medications can help with weight management.
How do they work?
Some of them work by suppressing your appetite, while others reduce the amount of fat your body absorbs.
Interesting. So they kind of target different aspects of the problem.
Yeah, you could say that. But it's important to remember that medications are usually used together with lifestyle changes, and always under the supervision of a doctor, of course.
Of course, that makes sense. And what about surgery? When would that be an option?
There's a type of surgery called bariatric surgery. It basically modifies your stomach or digestive system so you take in less food.
Wow, that sounds pretty major.
It is. It's a big decision, and it's not for everyone. It's usually recommended for people with a BMI of 40 or higher, or for people with a BMI of 35 or higher who also have other health conditions that are related to obesity.
So it's definitely not a first-line approach. It's something you'd talk to your doctor about very carefully.
Exactly. You need to make sure it's the right decision for you and understand all the risks and benefits. It's not something to take lightly.
That makes sense. Well, we've covered a lot of ground here. We talked about diet, exercise, stress management, sleep, and even medical interventions. It's a lot to take in.
It is, but I think the main takeaway is that even small changes, if you do them consistently, can make a big difference over time.
That's a great point. It's encouraging, because it's not about being perfect or restricting yourself all the time. It's about finding those healthy choices that work for you and sticking with them. It's a journey.
It is. And remember, there will be bumps along the way. There will be ups and downs.
That's life, right?
Exactly. The important thing is to keep going, stay committed to those healthy habits, and don't give up.
It really is encouraging to know that you don't have to do everything perfectly.
Right.
Just those small changes over time. And it makes you realize that, it's not all on the individual either. There's this bigger picture, this societal context we have to consider.
Oh, absolutely. We can't talk about obesity without looking at those environmental and societal factors that play a role.
Like what kind of things specifically? What are some examples?
Well, think about things like food deserts. Those areas where it's really hard to find fresh, affordable produce?
Yeah, I've heard of those.
That's a huge factor for a lot of people. Or think about the way food is marketed. how the industry pushes those highly processed foods.
The ones that are engineered to be addictive, like we talked about earlier.
Exactly. And they often target those ads towards vulnerable populations.
Wow, it's like the system is almost working against people sometimes.
In some ways, yeah. And then there's the whole issue of weight stigma and discrimination. People who are overweight or obese, they often face a lot of prejudice, negative stereotypes.
It's true. And I imagine that can really take a toll on someone's mental health.
Oh, absolutely. It affects self-esteem, and it can even make it harder to get good health care.
It's like this vicious cycle.
It really is, and it just highlights how important it is to be compassionate and understanding. We need to create environments that actually help people make healthy choices.
So what does that look like?
Well, for one thing, it means making sure everyone has access to affordable, nutritious food, no matter where they live.
Right, tackling those food deserts we were talking about.
Exactly. And creating safe spaces for physical activity, and just generally promoting education and awareness about healthy lifestyles so people have the information they need.
And challenging those societal biases and norms that lead to weight stigma.
Yes, that's so important. Everyone deserves support, Everyone deserves to feel empowered to make those healthy choices, no matter their size or weight.
That's a great message. Well, this has been a really eye-opening deep dive. I feel like we really went beyond just the surface level.
Me too.
We explored all those different causes of obesity, the health risks, and most importantly, we talked about real steps that people can take to address it, both individually and as a society.
I hope it's been helpful for our listeners and that they've gained some valuable insights and maybe feel a little more empowered to prioritize their health and well-being.
I agree. It's been really insightful. And before we go, I just want to say to anyone listening, you're not alone in this. There are resources out there, support groups, healthcare professionals.
Yeah, there are people who can help you on your journey.
And remember, you can do this. Believe in yourself and your ability to make positive changes, even small ones.
Small steps lead to big results. Don't forget that.
So true. On that note of hope and empowerment, this concludes our deep dive into obesity. Thanks for joining us, everyone. And until next time, stay curious, stay informed, and stay well.